A newly disclosed U.S. intelligence report is raising questions about the origins of COVID, including whether or not the virus could have escaped from a lab in China. According to the Wall Street Journal, a report released in the final days of the Trump administration claims 3 researchers from China's Wuhan Institute of Virology sought hospital care in November of 2019. It describes their symptoms as being, quote, consistent with both COVID-19 and common seasonal illness. That is a full month before Beijing confirmed the first official case of COVID-19 in Wuhan. The members of the World Health Organization are discussing the future of their own probe into the virus's origins. They determined that a lab leak was unlikely, but information from that investigation was controlled by the Chinese government, prompting criticisms about transparency. Dr. Jessica Justman is an associate professor of medicine and epidemiology at Columbia University's Mailman School of Public Health. She is also the senior technical director at ICAP Global Health, which is based out of the university. Dr. Justman, welcome. Thanks very much for joining us. First of all, what's your reaction to the details as reported by the Wall Street Journal from this U.S. intelligence report?
Well, I assume that the Wall Street Journal wouldn't have published the report without feeling confident in the sources of their information. On the other hand, I understand that the Wuhan Institute of Virology has refuted it. I do think it makes sense to call for a fuller probe, but I'm very aware that it really might be quite difficult at this point in time because hospitals don't routinely save samples on ordinary admissions for respiratory illnesses. Certainly, I can't think of a case where that would happen here in the U.S. So without those samples, I think it will be very hard to really conduct a proper and full probe.
Well, Doctor, looking ahead, the nation's largest public school system in New York City announced that remote learning will no longer be an option starting in the fall. What are your concerns about kids going back in classrooms?
Well, I think that having kids back in the classroom is going to be great for their education, and I think it will have a really good impact on moving the economy forward. My main concern is that only approximately half teachers have been vaccinated, and that vaccination at this point is not a requirement for all students and staff. Masks will be required, which is good. I really fully endorse that. But it would be great to see a much higher proportion of the teaching staff vaccinated. So I'm hoping during the summer months that teachers will go ahead and access the vaccination resources before they come back into the classroom.
And Doctor, let's talk about vaccine access. A recent poll from the Kaiser Family Foundation finds more unvaccinated Black and Hispanic adults said they were concerned about missing work due to potential side effects from the vaccine than white adults. How do we combat this disparity?
Well, I think that this finding that you're describing really points to the lack of safety net that many individuals in the U.S. Have to live with every day. They're living hand to mouth. They're not going to get paid if they don't show up for work. So I understand their concerns. Of course, if they get sick with COVID and miss work, they'll be missing a lot more work than what they might miss by just getting vaccinated. I think I would, try a multi-pronged approach of, more information, but that alone doesn't usually do the job. It's much better to have members of the community do the work of spreading the message and by setting an example and going and getting vaccinated. If it's possible to get more employers to allow a little more leniency for time off after a vaccine side effect, that would help too. But again, I think the really major problem here is lack of a safety net for many individuals.
Well, the CDC is investigating several dozen reports of teenagers and young adults developing heart problems after being vaccinated. And we should mention the numbers are very, very small. But how young are experts considering lowering the recommended ages for vaccination?
Well, I don't think that this report about inflammation of the heart is affecting the recommendations about age for vaccination. Instead, the recommendations about age for vaccination is really going to follow the scientific findings from vaccine studies. So we recently saw the we saw the FDA issue authorization for 12 to 15-year-olds for the Pfizer and Moderna vaccines, the messenger RNA vaccines. I think the studies are going on now, I think as you just indicated earlier in the show, for younger children. And when those results come out, that will guide the recommendations. Certainly, it's important to keep an eye on unusual side effects like inflammation of the heart. But at this point, that's, I think, really separate from the guidance on the age for vaccination.
And Doctor, we're of course continuing to watch what is happening with this pandemic around the world. India, we know, surpassed 300,000 deaths from COVID-19 on Sunday. What role could the U.S. play in helping countries where vaccinations are lagging? Could we realistically ship surplus vaccines overseas?
That's an interesting question. I think that we are shipping some surplus vaccines overseas. And it should help. There was news today that both the AstraZeneca and the Pfizer vaccines are effective against the variant that's circulating in India that's called B.1.617. So it's really great news and should help move India forward, given that less than 4% of the population there is vaccinated. Besides shipping vaccines, I would think that some guidance on technical approaches to rolling out the vaccine and strategies that have worked well here in terms of mass vaccination sites and then a more decentralized approach for other kinds of communities, that might be another way that we could contribute to helping India get past this very devastating situation that they're experiencing right now.
All right, Dr. Jessica Justman. Dr. Justman, we really appreciate your expertise. Thank you very much.
Thank you.